All right, we're going to go ahead and get started. So thank you so much, everyone, for joining us tonight. Good evening and welcome back to the One Health Academy. My name is Blair Budd, and as the director, I'd like to thank you for joining us tonight. And I wanted to wish everyone a happy new year and appreciate you tuning in after we took some time off at the end of last year. So hope you're off to a great start this calendar year, and we're looking forward to hosting a lot of incredible people working in One Health in this upcoming year. Great to see some familiar names and some also some new ones. So before I get into introductions, I would like to make everyone aware that January is One Health Awareness Month. So the One Health Commission, Louisiana One Health in Action, and the One Health Lesson Groups are leading the third annual One Health Awareness Month this January. So in our website and also in our email outreach to you guys, you can find links to see the continuously updated One Health Awareness Month guide, as well as the One Health Awareness Month calendar for certain ways to get involved this month. So if you'd like more information, there's also plenty of resources at the One Health Commission website. So check that out, and email and website if you'd like to learn more. And I'd also like to take this opportunity to thank the One Health Commission for sponsoring our GoToWebinar access, which allows us tonight to be with you remotely and throughout the pandemic. So we're grateful for their constant support and ask if you happen to be in a position to give back to support the One Health Commission in any way you can. So with that all being said, some housekeeping items for this evening. We want to ask folks to please use the question function to provide your comments or your questions in that feature instead of the chat feature, so we can condense that in one spot. And also to flag that our speakers tonight have requested the audience's feedback following the presentation or throughout. So please be ready to be engaged at that point. And thanks for tuning in. All right, now I'll go ahead and get started with introducing our two lovely speakers. One, Dr. Jayne Morrow, has demonstrated a career working across stakeholders to foster engagement, create strategic vision, and build consensus, including development of standards on a range of technical programs and public policy areas of national security, environmental health, public health, and safety and law enforcement. Dr. Morrow formerly led the National Science and Technology Strategic Policy Development as the Executive Director of the National Science and Technology Council in the Executive Office of the President during the Obama administration. And prior to that position, she led biothreat response and metrology for biological science programs at the National Institute of Standards and Technology. Her research efforts have resulted in 45 peer-reviewed articles, reports, and standards, as well as over 200 technical presentations and operational exercises. Recently, to enhance the response to COVID-19, Dr. Morrow partnered with motivated volunteers to form a nonprofit, IBEC, and hosted the Clean 2020 Summit to bring together leaders from business, policy, standards development, science, and engineering to better understand current knowledge and identify opportunities to work together to control viral transmission in the built environment. She currently serves as the Assistant Vice President of Research and Economic Development at Montana State University, where she's working to develop stronger connections between science, technology, and research among academia, industry, and government agencies. She has a Bachelor's of Science degree in Civil Engineering from Montana State University, as well as a MS and PhD in Environmental Engineering with a specialty in molecular and microbiology from the University of Connecticut. Thank you, Dr. Jayne Morrow, for joining us. And we are also joined tonight by Kenneth Martinez, a certified industrial hygienist and environmental engineer with experience in leading and conducting large-scale research, managing programs in occupational safety and health, and emergency response, as well as creating and teaching professional development courses. He brings 33 years of CDC experience in hazardous agent exposure characterization and mitigation control practices in the manufacturing and healthcare industries. Over a 9-year period for CDC, he served in numerous emergency response field leadership roles, including the World Trade Center collapse, anthrax, SARS, multi-drug resistant TB, hurricane emergency responses such as Katrina and Wilma, and the Deepwater Horizon oil spill. He's also provided counsel and leadership to senior management of other federal agencies, including providing testimony before a congressional subcommittee on Capitol Hill, presenting before senior leaders of the OSTP, GAO, USPS, DHS, EPA, and FBI, and serving on the CDC team tasked to provide responses to a strategic plan to the Pandemic and All Hazards Preparedness Act. His research efforts in bioaerosols have resulted in 38 peer-reviewed journal articles and book chapters, 32 NIOSH technical reports, and over 100 technical presentations at scientific meetings and courses on bioaerosols targeted at the local, state, and national level. From 2013 to 2020, he supported DHS as a contractor for a national airborne biodetection system, serving as the jurisdictional coordinator for 2 jurisdictions, as an environmental assessment team lead, and as a field operations team lead. And subsequently, he provided contract support to FEMA, CBRN, and FDA. He currently serves as the Senior Critical Infrastructure Analyst for Idaho National Laboratories and concurrently operates as an executive officer for a nonprofit created to provide support of COVID-19 pandemic response efforts nationally. Thank you so much for both of you. What impressive bios. Thank you for joining us tonight, and the floor is now yours.
Well, thank you so much for the introduction. It's so fantastic to be here with you this evening and to share a bit about our latest project, IBEC. So I always love sharing the stage with my friend and colleague, Ken Martinez, and have had such a privilege working with him on this important project, and so timely. And we're excited to hear more from this group as far as what we can be doing in terms of environmental health and opportunities for greater collaboration with One Health overall. So Ken and I are going to tag team this talk. We're going to share our perspective on the slides and look for your feedback as we go. So please don't hesitate to put questions into the chat, and we will be checking periodically. So we are IBEC. We are the Integrated Bioscience and Built Environment Consortium, and we strive to understand the implications of pathogens in the built space and how it impacts people. So I'm going to move through our slide deck and look for opportunities for Ken and I to both provide our contributions. One of the things that we wanted to stress for you all is that when we started IBEC, our main intent was to bring experts that understand buildings and environmental systems. So we're not just thinking about the built environment, but in the age of COVID, so much of transmission is happening in the built space. We really wanted to understand what those challenges are. So buildings and environmental systems, environmental microbiology, so the existence of pathogens in these complex environmental spaces, and then human and social systems. So often the human sciences and social sciences are left out of the conversation at an early enough stage where they can have significant impact and positive benefit to society. And so we really wanted to be inclusive of our understanding of human factors early on in our work and structured all of our work groups with that in mind. One of the areas that we've been thinking extensively about is how to foster community around these 3 separate niches of science. And when you think about fostering community, it's really helping to envision how we can work together in diverse teams and how we can achieve equitable solutions to some of the problems and challenges that we face. We are very strong in collaboration. Everything that we have done has been grassroots from the start, and so we look forward to sharing more of that success with you all. And then fostering consensus is the way that we see our work moving forward. Science is beginning to gel. We are starting to see some of the methods and capabilities arise to the point where we're starting to see consensus. And in some places we had consensus for a long time. And that's something that Ken and I both share in terms of experience, and we look forward to sharing some of that activity with you as well. And most of our work has focused primarily on transmission indoors, because so much of our response has been to the pandemic, and transmission of the pandemic of SARS-CoV-2 is happening indoors, and really helping people understand what that means. So I'll let Ken also share his perspective on the value of our work on indoor transmission as well as broader environmental systems.
So with this particular graphic, we wanted to communicate that there are complementary mitigation solutions or strategies that can be used to reduce the risk of airborne transmission in the built space. We know that vaccines are critically important. We know that human diagnostics are critically important. But if we can do things like introduce more outdoor air, filter, as you can see on the second floor with a portable air cleaner, when the filtration efficiency might not be efficient enough to reduce that risk, or other mechanisms such as the system itself exhausting the air. So this graphic is depicting all of these different strategies that can be used specific to dilution, specific to ventilation. Jayne?
So when we embarked on our work, the first thing that we were working to identify back early in 2020 was what is the state of the science and where is the science translation needed most? And so we hosted a series of summit stages that looked closely at different elements of those questions. And all of that work occurred over a 6-month period in 2020. Ken, do you want to share more about those sessions?
Yes, thank you. We were very pleased with the attendance, with the number of speakers, which Jayne will talk about in the next slide. But through the first 3 sessions, we brought together industry and science to the same table. We wanted to hear what industry needed, and we wanted the scientists to say, well, we have solutions that we're researching to work on that. We had University of Oregon, we had University of Maryland, we had Northwestern University, but more importantly, from the industry side, we had big partners that were at the table to speak, like Coca-Cola, IBM, GM, Hilton, Marriott. But we had some small business discussions as well because we had representatives from the Small Business Administration, the Better Business Bureau. So it really gave us an opportunity to understand what that landscape looks like. The most important one for us, at least, was the last one in December, was actually sponsored by the Department of Homeland Security, who wanted to explore the problem of counterfeit and fraudulent PPE, specifically respirators. So we brought together a group of people to discuss that specific issue. Jayne, back to you.
Thank you, Ken. And those findings are still highly relevant today as we work to navigate and understand the landscape in response to COVID. Just building on Ken's comments, one of the challenges we really worked hard to understand early on was the implication for all size business. And as Ken alluded to, we did have small business as well, including even a small franchise owner out of rural Montana who was struggling to get science to the table and understanding what that meant for her business and her ability to stay open during the times in the pandemic. The summits were exceedingly successful beyond what we had hoped. And we reached over 1,250 attendees from 16 countries. We produced a lot of programming. And at that time, it was so agile. We were trying hard to listen and be responsive to what we were hearing. We were working very hard to make each stage of the summit build on the previous stages and incorporate the findings, and have worked hard to get that information out into the public space. We're still working on how best to share those additional hours of programming and have a membership program that's growing out of our work in which we're trying to get more of this material digested and into the hands of broader user groups. So part of what we've begun to focus on is bridging this gap between where we have the proven scientific process and what the real world applications look like. So much of what we were finding early on wasn't being integrated into practical application. It's just challenging. Science is emerging, it's dynamic, and part of the challenges that we faced here in response to COVID has been helping to interpret that science and being interpreted by scientists. So much of our findings, we know from one study to the next how to interpret some of a study's deficiencies or how to look at what that study is telling us over the previous one. That isn't always the way that the science is projected back to the public domain. So we're really looking at how organizations like ours can digest that information and make it translated and easy to access. And we're going to share our work in that space with you more this evening. We're also working to define practical quality control processes for healthy spaces. So much of the discussion around what is healthy and how healthy is defined is is open-ended. We're leaning heavily on association findings, including the American Industrial Hygiene Association, the Indoor Air Quality Association, and the National Safety Council, to bring some of these digested guidance documents that are already out there and make them more accessible to a broader audience, while respecting how quality control is currently handled and managed. And eventually, we're hoping to get real-time measures of environmental transmission potential into the hands of greater groups of users. And we know that this is a struggle. This is our long-term goal, and we're really working hard to get there, and considering the role that consensus standards and other activities can help support that. So we're also focused on how we translate our knowledge and how we share our information as scientists with a broader audience. Keeping in mind that this translation is needed, we're going to share a new program that we're starting that helps to get some of the information and educational materials into the hands of a broader user group. And this is our Commit to Care Pledge program. So we'll go into that in a few minutes. But we also continue to meet in our summits, and we have a lessons learned summit series that happens once a month, and we have panel discussions, we have speakers similar to this where you hear from someone with a unique perspective. We're also a growing membership organization, and we eventually hope to become a standards development organization. At least that's what our Science Advisory Board has recommended, and our board of directors. So in terms of membership, who we are, like I said, we're growing. You can see the contributions from the Science Advisory Board that participated in the summits. You can also see those individuals that were really active in driving us to this point so far, as well as those that are with us doing this work every day. We have representation from both academic institutions as well as those individuals that are out there doing the work in terms of advising others and detecting detecting SARS-CoV and other biological threats or materials and pathogens, as well as organizations that are actively implementing the science in their training programs and using the science to guide how best to keep their workers safe. We're currently structured with a board of directors, a science advisory board, and an applications advisory board, and those boards are just getting started. So if you're interested in learning more about our work in this space and how you can join us in filling out our applications and our work going forward, we would welcome you to our group with open arms. We're really looking hard at where we need to be balanced, keeping in mind that we want to focus on human factors, environmental exposure, environmental microbiology, and opportunities to better understand the built environment. Our membership program is growing, as I mentioned, and we have created a dashboard and an onboarding tools to help our members benefit from the experience of being part of IBEC. It's difficult to share information. It's difficult to share all the activities that are happening across the response to COVID, and we really wanted to make sure that our members have a collaborative space where they can do their work together. We're also developing a research repository, and anyone can access the repository. In fact, we strongly encourage you and others to access what we've generated and to share and share documents that you feel should be there with us. We'd really like to see the research repository grow. One of the things that Ken and I realized early on with our experience working in the federal system is that a lot of the knowledge products that had been generated over many decades in our federal service, and we knew in the service of others, really wasn't in any one place. It wasn't consolidated. And so we're hoping the research repository can be a place for that information. IBEC members have the opportunity to leave comments and to upload material. Anyone can leave comments in our comment boards, but IBEC members can also provide additional responses to those comments. We're also working on knowledge product dissemination. And so we have custom knowledge products that we've generated in response to questions we've received from our members, as well as others that are on our science advisory board and just really active in the work that we're doing. We are trying to bundle those products and can make them more broadly accessible depending on who your audience might be. And we're also working to establish an e-learning tool that is partly available through the Commit to Care Pledge program. And we're continuing our discussion. As I mentioned, we are hosting the Clean Lessons Learned Summit discussion series where we have monthly topics. In December, we covered communities of faith and safely gathering in times of COVID, which was hosted in partnership with the National Black Church Initiative. And in February, we're shooting for February 8th to host another discussion with the American Health Law Association that are some of the legal implications of COVID and how we can work together to respond and support them. And all of this work is being coordinated in collaboration with the American Industrial Hygiene Association, ABZAN out of Australia, and the Indoor Environmental Quality Global Alliance. Just to give you a sense of what we talk about in these discussions, Dr. Lydia Maraska helped kick us off back in August and shared what she understood about how to safely open our economies and get back to work. And most of her discussion was around the airborne transmission route and how to reduce that transmission. And Lydia is a prominent leader in the field. She's also a member of our science advisory board and active in our work. Lastly, one of the things that we've done this fall is to try to host some engagement for students. We worked with the Association of Public Land-Grant Universities and through the honors colleges and the work that they're doing to develop some student engagement that's across the nation and looking at how honors colleges and our amazing students and student researchers can be brought to the table in our discussions about how to better respond to COVID. And they were very concerned and interested in talking through the challenges that we have. And I know this will resonate with this group. How do we keep people safe, but also keep the planet healthy? And part of the challenge we have in our investment in our response to COVID is we've had to let go of some of our goals for sustainability. And so we talked at length about that. We hosted 2 panel discussions, and then the students broke out in a dynamic exchange. And they're continuing that conversation and generating a publication out of their observations about wanting to be at the table for these discussions and inform some of the science and technology investment, but also the policy and human engagement. Ken, I'll let you take it for the next chunk of slides.
Thank you, Jayne. So the American Industrial Hygiene Association actually partnered with us on 1 or 2 of our Clean 2020 summits. And so they were very pleased and impressed with the content, with the groups of people that participated in that. So AIHA won a CDC grant in the early part of 2021, and they reached out to IBEC. They said, hey, you know, we were pleased with what you guys have done with the Clean 2020 summits. Would you like to work with us on delivering knowledge products for the CDC grant? And we accepted without hesitation. It was about creating some knowledge products such as 20 micro-training animated videos that targeted small business, education, healthcare, long-term care facilities. We also added supporting worksheets, tip sheets, infographics. The accessibility was quite broad. It was to colorblind. They were closed captioned, the videos. And we actually translated into 8 different languages. The voiceovers were in English and Spanish, but we had closed caption in an additional 6 languages. We completed all of that project work at the end of the federal fiscal year in September 30th of last year. But we were given one more project, and that was to deliver a needs assessment summit. They wanted to bring in specific industry sectors to talk about issues where they were classified as vulnerable populations or occupations. So those industries included the first responder industry, the educational industry, K through 12, daycare centers, and institutes of higher learning, the gig economy, which was a new one for us to explore and get a sense of what was happening there, and lastly, vulnerable populations in agriculture and construction. We also were tasked with disseminating these knowledge products we created. And part of this was a 4-step risk assessment tool that we created as part of the Commit to Care pledge, which we'll talk about in a little bit. And also the multi-month communications and outreach programs that Jayne alluded to with the Lessons Learned series. Jayne?
So Ken, I'll let you walk through the Commit to Care pledge program.
Thank you. So we're very, very excited about this program. And again, this is a partnership with the American Industrial Hygiene Association. We wanted to create a more level playing field of awareness with regard to COVID. Again, the message is vaccination, critically important, human diagnostics, critically important. But since the broader scientific community has determined that the airborne route of transmission is the primary route, we believe that there are complementary mitigation strategies in the environment that can be applied to help reduce that risk of transmission. Not eliminate, but reduce the risk. And that's the message we want to deliver. To this day, of my former agency, CDC, has not made the statement that the airborne route of transmission is the primary route. They still say respiratory droplets. And this has been, in my opinion, causing much confusion amongst the users, those who are being impacted by the pandemic. So it is a grassroots effort. It is free. It is at no cost. We just want to, as I said, level the playing field. We want to create an environment where the employees, the customers, can have a conversation with an employer or a business owner, because they may walk into a restaurant, for example, say, oh, there's a portable air cleaner there. I know what that's for. Thank you for doing that. Thank you for making my environment safer for me to enter. So we want you to pledge to do your part in making your building, organization, and community healthier and safer from COVID-19. And this is driven at the individual level, right? So next slide, please.
And I just want to build on Ken's comments that one of the sources of feedback we've received is that if people understand the root of the guidance and they understand why there is something like a mask mandate, then they'll be more apt to use the protective measures that are being recommended. And so that is the intent of this program, is to help communicate what Ken and myself and others that are trained in this field really understand, is how do you reduce that risk of exposure by implementing various different ways of protecting yourself and others. And so it's not meant to replace or substitute for vaccination or routine diagnostics, but used in addition to.
Thank you, Jayne, for expanding on that. So CARE actually stands for community, for awareness. And actually, that it should be responsibility, not resilience. We need to fix that slide. And equity. We recognize that there are equity issues as far as delivery of vaccinations, acceptance of vaccinations, accessibility to medical countermeasures, and the like. So Commit to Care was actually developed by global experts, scientists, and research who were guided by the current peer-reviewed science, right? This included AIHA, this guidance that they developed for the Get Back to Work Safely. This included CDC and EPA. We wanted to make all of this content traceable back to a reference standard guidance criteria. And the point being to reduce the risk of transmission, but also prevent of other highly contagious airborne diseases like tuberculosis and measles, which are recognized to be airborne routes of transmission. Next, please. So we designed it so we would target specifically 3 groups of users, right? For employers, for employees, and for the general public. Now, we may expand that later to be more targeted in our industry selection, but right now, understand that we wanted to take that science from AIHA, from CDC, and other organizations and make it digestible, make it easy to understand. So each of our videos are only 2 to 3 minutes in length. So even though it's a training, it's quite simple to get through and quick to get through. But again, it was just to provide a high level of awareness of what these key issues are. It was designed to educate and help guide organizations across the globe through easy to understand visual trainings and risk-based assessment tools. Now, having said that, with the revelation of the OSHA Emergency Temporary Standard, which is in flux right now, much of our content aligns quite well with that current standard. Now, we didn't mean it to fulfill all of the ETS requirements out there, but it is a start to help people to understand about, okay, now there's deeper trainings I need to take to better understand what these issues are. Next slide. We do have partners that have already signed on to support what we're doing, and we're very proud with the National Safety Council, the Association of Occupational Health Professions in Healthcare, the Indoor Air Quality Association of Australia, and you can see a second medical facility, the Society for Medical Organization, Society of Critical Care and Medicine International Safety Center. We have vetted this with many other organizations out there, trying to get them to join us to be able to do this. So as professionals representing occupational environmental health and safety, infection prevention, healthcare, biosafety and security, and building engineering, we must come together. This must be a holistic approach. It can't be just from one discipline, such as from a doctor saying, we need vaccines. We wanted to make sure to be inclusive of many different disciplines, because being able to manage this airborne route, it's got to be more than just a medical response. Collectively, these experts that know how to keep the indoor environment safe and mitigate the spread of pathogens, right? So my experience, as well as Jayne's, we've spent years in the environmental microbiology world. For me, it was about not just mold and indoor air quality, but I transitioned my expertise into infectious biological agents, both threat agents, but also infectious disease agents. But again, the message being reducing the risk of transmission of an airborne virus like SARS-CoV-2. But this can also be applied, as I said earlier, to measles and tuberculosis. Next slide. So we boiled this down into something that we consider very simple. I'm a scientist, 33 years at CDC, and I go figure. So I was tasked to write up a document on risk assessment, on risk factors. So I wrote this 9-page document that at the very beginning had an equation on infectious disease. Our comms people laughed at me. They called me a nerd and said, Ken, we can't deliver this. You can't push this out there. So they helped us all to boil this down into something very succinct. And we call it the 4 Ds: density, dilution, distance, and duration. But it's a holistic approach. But again, right there at the top, it says vaccination and human diagnostics are critically important, but we need to consider these other risk factors in order to minimize or manage this pandemic. Next slide, please. So let's go into them specifically. So this is a risk factor, duration. And as an occupational, as an industrial hygienist, it's very clear to me what duration means. If I was in a chemical plant, for example, a furniture stripping plant that uses methylene chloride, well, the longer that worker hovers over that tank, the greater their risk of a health impact, because it's about concentration. The same thing applies with an infectious disease such as COVID-19. The longer we're in an indoor space that has invisible virus aerosol particles, the greater our risk goes in. So we lower our risk by having shorter times. Again, a risk factor. Next slide. The other risk factor is density. How many people, when you walk into a room, are you seeing in a circle? Who's wearing a mask? Who's not? Who's vaccinated? Who's not? You cannot assume anymore that someone who's not wearing a mask is vaccinated. And in the days of Omicron, even if you're vaccinated, you could still contract COVID-19. And if you are asymptomatic, symptoms are not appearing, you still are spewing forth viral-laden particles and putting at risk all of those around you. So density becomes an important consideration when walking into a room. Next slide, please. So risk mitigation, the first one, and probably the most important one, is dilution. If you're outdoors, we know through scientific research that ultraviolet light will kill the organism rather quickly. We have wind that's blowing around that will dilute it very, very quickly. If you're outdoors, SARS-CoV-2 can only survive for 2 to 4 minutes. And this was found by research conducted by the Department of Homeland Security. So more open space or cleaning the air is a way to reduce your risk. So in the indoor environment, that means filtration, that means the introduction of more outdoor air and other mechanisms to reduce the viral content in that space. So risk mitigation. Next slide, please. Another risk mitigation factor is distance. The farther you are away, the more those particles will have a tendency to find equilibrium. They will spread apart. And as they spread apart, that concentration becomes less. So it would not be, we don't know what the infectious dose is for SARS-CoV-2, but if the concentrations goes down, that puts us in a better place with regard to risk. However, having said that, we also want people to recognize that there is an abundance of scientific literature that has shown that the virus, especially these respirable-sized particles, can travel long distances, 20, 30 feet. there is case after case of super spreader events where people in large rooms contracted disease even though they were distal from the person who was the super spreader. Next slide, please. So let's protect, go ahead, Jayne, is this you?
I was just going to say, one of the things that we wanted to just show you is just briefly how this information is being presented in Commit to Care. So we have several slides that just give you a glimpse of what the training program looks like, and I'll let Ken walk through them. I just wanted to raise that to the forefront when you got started, Ken.
So these are layers within the training of things that we believe that people need to understand. The first one is determining your risk. And again, this is a video training that is only 2 to 3 minutes long to help people to understand the risk factors, the 4 Ds, and then come to that conclusion of, am I high risk or am I low risk? And what's the result of that determination? Well, maybe I should be wearing an N95 respirator if I'm high risk, such as a healthcare worker. I would classify your server in your restaurant to be high risk because by design, you're all sitting around the table eating, drinking, maskless, and enjoying life, if you will, at that point. But your server doesn't know if you're sick, if you have COVID-19, if you're vaccinated, yet they're coming to serve you in just a mask, which is, of course has a lower protection factor than an N95. We also have an interactive risk assessment tool that's web-based, that's based on some hazard banding, control banding concepts that was published by Sitsima a number of years ago. And it's just a very easy and a simple way to understand this matrix approach to determining risk and what control measures are available. Next. Workforce training, of course, that's very, very important as well. I just spoke to how to determine if your worker is high risk or low risk. You use the risk assessment tool, and that's in the second bullet point there. We have video trainings on why masks work. We have video trainings on how to properly store and wear a mask. So you all know right now that the administration is going to push out a number of millions, hundreds of millions of N95s. And I think that's a great idea. But people do not understand, unless you're trained in occupational safety and health and fit tested, how to properly wear that. Though I've seen them wear it upside down. I've seen them not pinch the nose thing. I see them wearing it in different ways that don't get that tight face fit. Understand that the assigned protection factor for an N95 is 10. What that means is that a properly fitted N95 will reduce the concentration outside the mask to inside the mask by 90%. Is that good enough? We don't know the infectious dose of SARS-CoV-2. It is protective, legitimately so, but it reduces the risk of transmission. It doesn't eliminate. So the same applies for masks as well as respirators. So we do have a video for high risk categories to talk about respirators and how to properly store and wear those respirators. But lastly, we have a video on ventilation and what that means for the risk of exposure. Again, each of these videos is only 2 to 3 minutes in length, so it will not take a lot of time to move through that. But again, create a common understanding of what these key issues are. Next. Let's focus a little bit on ventilation. I talked about the video. We also have included checklists, which we've already started sending out to people. What are the things I need to be concerned about a checklist? Well, ASHRAE recommends increase to a MERV 13 filter, more outdoor air, but it doesn't always get applied the same in your environments. If we focus on, for example, a long-term care facility, you want that air in that patient, that susceptible patient who is not infected with COVID-19, you want that under positive pressure. And why do we do this? Because we don't want air that's contaminated to come in and put them at risk. So those considerations are actually addressed in our optimization checklist and also the ventilation video. But we've also included a portable HEPA air filter checklist because there are going to be many systems out there that are not amenable to putting in increased filtration. When you go to something such as a MERV 13, it creates a higher pressure drop. Systems not designed to handle that higher pressure drop, the fan motors will burn out, the cooling coils will freeze up. There's any number of different things that can happen. So what is your option? Do you replace that ventilation system? Perhaps, or you deal with what you have and add additional supplemental control technologies such as portable air cleaners. Next slide. We also offer print and post supporting workforce materials. So if you go through the training, now you have a little poster that you can place in your business that talks about proper mask fit poster or proper respirator fit poster. Also, an educational material that shows that you understand the 4Ds and lets others who come into it, whether you're being employees or your customers, read that. And this is what I meant about creating that common playing field of understanding, is that if your employee comes in and sees it, they're going, oh, they're protecting me. They're doing their best to protect me. And then also a ventilation tips poster. Some of the customer aspects are wearing masks, educational posters. We're also going to offer Care Pledge window decals so that if your customer comes to that store saying, hey, this is a good thing to observe. We, as IBEC, we don't think it's a good idea to have certifications programs right now. I know that there are a number of them out there that are based on indoor air quality, but the translation from indoor air quality to pathogen infectious disease is not an easy jump. So we want to make sure that we're doing it right, that we're communicating. That's what the Commit to Care Pledge is about, is education. And as Jayne mentioned earlier, we want to become that standards development organization that can actually begin to define what those criteria look like. Next slide, please. Most importantly is who's going to help you in your place of business. Well, I'm a certified industrial hygienist. So from my perspective and that of AIHA's, it is an occupational health and environmental safety professional. As an industrial hygienist, I have been trained to do risk assessment. And that means I can identify the hazard, or I can anticipate it. I can identify it. Once I identify that hazard, I can evaluate it, meaning taking samples, understanding if it's high, if it's low. And once I determine it's over some exposure criteria, I can then apply mitigation factors. So this is the appropriate discipline to access and say, hey, how can you help me better understand and what can I do? So we also have one on how to find an occupational health and safety professional. Next slide, please. As I said at the beginning, we have not ignored the fact that vaccination is important and testing is important. So we have two policy statements, two fact sheets that actually walk through those two components as well. So we wanted to be complete with how we're presenting this information and how we move forward. Next slide, please. So please go to committocare.com. That's commit number 2 care.org. It's free. Doesn't cost anything. Register, go through the trainings, give us your feedback. Let us know if this is helpful, if we need to evolve in a certain way.
So lastly, and thank you, Ken, for going through the Commit to Care Pledge program. We're very excited about this program. It's been a huge investment for our team, and working in partnership with AIHA and through the support from CDC NIOSH. And we're really working hard to get some of this knowledge into the hands of broader users. We felt the Pledge program would be an appropriate way of helping people engage in this new activity that we have, but also help people to understand the fundamental science that's behind the guidance that's coming out and consistently reiterated across federal organizations around the world. And in order to also reflect on where we are, we've been paying close attention to various different efforts that have been coming out of the White House. I know many of you are joining us from DC, and just recognizing that in both Ken and my past experience, really looking to that guidance from the White House and the interagency to better understand what's needed going forward. And so one of the areas we're looking for growth that I know will resonate with many of you is this opportunity to further explore environmental surveillance and what that means. And it was recently called out for additional investment in the administration's the brand new administration's effort to transform capabilities in pandemic preparedness. And there's a lot of very strong recommendations in the existing guidance that came out for the federal agencies. It's guidance for their investments that came out of that documentation. And one of the things that we could readily see is that in order for us to really ensure situational awareness about infectious disease threats, we have to understand what monitoring systems can achieve and how do you factor in what a warning system might tell you into a behavior or some kind of action, and often called in the biological threat arena a concept of operations. How will you use that information to inform a decision, and how can we work together, those of us that understand risk in the built space, to guide some of that conversation going forward? There's also a lot of discussion around personal protective equipment and ways in which the built space can serve to protect and help mitigate the potential. And so when we were looking, one of the things that really jumped out at us in terms of ensuring situational awareness is a clear recommendation to look at viral threat detection through environmental monitoring. And as many of you are likely tracking, just as we are, wastewater monitoring, water systems, air handling systems, these are places that we can engage with that built space. It's not intrusive to the human factors and the human interactions in our social dynamics. It gives us a chance to monitor and better understand what's happening in that built space. And then also thinking about pathogen protection in that built environment and what does that mean? And so what are high risk infrastructure environments and how do they need to be retrofitted or supported? And the administration has been recommending opportunities for schools and other organizations to support that. And we're happy to see the administration push out some of these recommendations, and we're looking forward to the federal agencies demonstrating how they wish to embrace them, including all of our colleagues from the EPA. We really value the work and effort that you're putting forward to understand and help us reduce risk. So lastly, we just want to invite you to join our work. We continue to meet as a collaborative consortium. We have a number of efforts moving forward. We've tried to share some of them in an overview today. We hope to continue to coordinate this knowledge and information sharing so that we can eventually move these state-of-the-art capabilities into more impactful standards, policies, and procedures, and then transition that research into practice. And like I said, the state-of-the-art science, how do we get it into the hands of broader users? And more importantly, how can we use the science to guide decision-making? These are all efforts that we continue to work to address at the work of the consortium and also through all of our members and the partnerships that we've developed. And then promoting confidence, data-driven solutions. We're really working hard to make sure that when we recommend something that we've all looked at, that we vetted it across these domains of science, so not just within one, but thinking about the human factors, thinking about equity and social engagement, and being intentional about the exploration of various different pathogens or environmental microbiology implications in that built space. And so we ask you to join us. We are looking for members who are advisory boards and can join our initiatives going forward, including our members are guiding us into different summit stages that we need to work on and opportunities for the repository and other activities. So that concludes our presentation, and I'm not sure if we have received any questions. It's a little challenging for me to see,
No,
so I'm gonna.
don't worry.
Go
Jayne,
ahead.
I was just going to say that no questions are in the question box at this time, but I'll go ahead and start us off to give folks a chance. And wanted to say thank you so much, Ken and Jayne, for what an incredible presentation and really great visual aids. I was curious, what opportunities does the current administration, since you kind of highlighted a lot of their focus and your own focus on equity issues, what kind of opportunities does that present for groups like IBEC and your support organizations?
It's a really good question. One of the things that we're striving for in our work as becoming a standards development organization is to make sure that engagement is balanced and transparent. And so inviting, being very intentional about who we invite to the table, being inclusive in our reach so that we are not excluding both technical experts but perspectives on the impact and decision making, and then being very intentional about how we listen. And so when you're leading a discussion, being open to diversity of thought and being intentional about the environment and the way in which you provide opportunities for communication. When we have been conducting this work at IBEC, one of the things that we've been striving to achieve together is the diversity and technical perspective, and really thinking holistically about our teams so that we're also benefiting from diversity of perspective in the folks and industry that we're working with. And I'll let Ken add to this because I know he has good ideas and advice on how to continue to be inclusive and equitable, and has done a lot of work with the Black Church Initiative already.
It's complicated. We do know that some cultures are not as well vaccinated as others, and I know that the president of the National Black Churches Initiative has communicated that to us. They wanted to regather during the Christmas season, but that got pushed back a little bit because of Omicron. They were very concerned because the southern states, many in their community, were not vaccinated for various reasons. And so we are working with them very, very closely to promote not just the commit to care, but the concept of there are other things that we can do. As far as in the environment, I'm working with the pastor to create a model church that will exhibit some simple to use ventilation, air cleaning devices that will improve that and lessen that risk of transmission in the built space. So I remember the question that you asked before with regard to what we can do as far as the current administration, what opportunities present to us. We're looking for opportunities to help craft the message. And we're not the only ones. IBEC is working with the Canadian Airborne Transmission Coalition. They're communicating the same messages that we are in Canada. We are also working with the World Health Network because they're communicating the same messages. There are organizations, nonprofits out there, ad hoc groups that recognize that we need to do more about the built space. And why we're not seeing this from our government leaders is confounding. We did see from September that the current administration has included that as part of their focus areas. So now it's a matter of just getting the right federal agencies together to push that message forward. Who's going to take responsibility? Who's going to take the lead? And again, from our perspective, it needs to be a holistic approach. Each agency has something that they can offer.
And I think that the initiatives coming out of the White House are important. They're timely. It's nice to see that coordination is happening, and hoping that will be reflected in agency budgets so they can pursue some of those expectations that have now been established in the broader community.
Yeah, I'm curious, just as a follow-up to that point, how does exploring broader federal involvement look, especially considering a lot of misinformation or just misunderstanding, and the example being of obviously with the pandemic, but more generally the complex science realm?
Yeah, well, and I think part of the challenge that we've all faced, and especially for our colleagues in the federal government that have been working hard to address these issues, the scientists really haven't controlled the messaging. That really hasn't been something that, and when I say that, I mean that there's a process for understanding when the science has arrived at a consensus opinion, and we're not driving that. So the scientists aren't driving when they've reached consensus. It's in the popular press, it's in the media all the time, every time there's a new study. And we know how to interpret. I mean, that's what we're trained to do, is to really interpret what a study can say, and more importantly, what that study doesn't tell us. And then we know how to fill the gaps that we identify with additional work. That's what we're trained to understand and better articulate. So when you look at some of what's happening in terms of this message and this response, I think it's in part because the science just wasn't, in many cases, mature enough to really understand for the users to really understand what that would mean. And so the science translation is really important. It's also important for us to lead the discussions around translation. All too often, a scientist will publish a paper, we could get over the fence, and we're lucky if the popular press picks it up, that's great. But the reality is we need to be active in that communication process. And I think that benefits our science agencies as well. They've made huge investments in the research underpinnings for a lot of what's coming out in terms of the guidance, but that disconnect is still there with the public. And so we're trying to bridge it. We're trying to rise above the noise. And I know that all of our partners across the agencies are trying to do the same thing.
And I think that's one of the ways that we're hopeful that the Commit to Care program will kind of elevate that communication. If we make the science more digestible through these simple to watch videos, if we highlight what are the things that everyone needs to consider, risk factors, risk assessment, ventilation, masks versus respirators, then again, people can start having a dialogue because we're all speaking the same language. And again, it's free, right? I mean, and as we grow with the Commit to Care program, we can add more to it that will better educate, better train people on how to improve their built environment to make it safer, not just for themselves, but to everyone. We want to ensure that people are protecting themselves, protecting their families, protecting their coworkers, protecting their communities. I actually had a great conversation with an OSHA person today. And earlier in November, I had talked to them about the 4Ds. And he made comment to me, he says, every time I go into a public space now, your voice is in my head and I'm sitting there looking at people, who's wearing masks, how closely are they populated? I just want you to know that it's now on me all the time. And I said, good.
That's awesome. I just really amplifying, Ken's comments here. The science is finally starting to gel. We know in many cases what multiple studies are telling us, and we're evolving that science based on the variants as they present. And I think we're in a very different place than we were in August of 2020. And that being said, that gives me a lot of hope that as we come together and we amplify our voices as to where that consensus is formed, Ken and I have been leading this conversation at IBEC to be engaging other associations that are passionate about these issues and really understand and know how to interpret that science so that we can elevate above the noise. And I think that's really been one of the leading challenges that we all face in this response, is making sure that the best information is in the hands of that broad public domain.
So one question that was raised to me today, and we'll kind of generate our own questions here, was what do we do about fatigue? How do we push the message when people are tired of it? And I know we all are, right? I mean, I've largely not been in that circle that I existed in 2 years, right? We don't go to restaurants. Periodically, we might if they have an outdoor eating section. I still go to the grocery store. I still go to the hardware store, but I wear a mask every time I do it. My children still go to work. My son does not because he's worked from home now because his offices are not open. So as Jayne had put in the earlier slide deck, this is the new normal. Fatigue is complicated. I know everybody wants to get back to normal, but I don't know that we'll see that, at least in the near term, because Omicron showed us that the variant is still, or the virus is still evolving, and we can't state whether it will become endemic and accepted by people. There was one article I read said it will always be epidemic moving forward, and we're seeing some fast mutations from this virus. There will be other variants that may be less severe, that may be more severe. We just don't know at this point in time. So we need to all adjust our thinking. We can get back to normal, but it will be with caveats until we can get through this. A big part of it, as we all understand, is that a large portion of our population is resistant to vaccines. And I'm not talking about those with religious beliefs that forbid it or other things, but when only 30% of our population is still unvaccinated, that puts all the rest of us at risk. It's not about me. It's about what I can do to protect others. So if I'm vaccinated, I'm doing my best to protect those around me. If I'm masked, I'm doing my best to protect those around me. If I put a portable air cleaner in my office space, again, that's my attempt to protect others, not just me.
And we just really want to thank everyone from One Health, and in celebration of One Health Month, thank you for giving us this opportunity to share our work. It's been a great conversation, and we really appreciate all of the support that you've offered us and look forward to sharing more as our work unfolds.
Thank you so much, Jayne and Ken, for an incredible presentation, some really important takeaways, and your contact information is on the shared slide if folks choose to reach out for any reason. Is there a next event or next sort of opportunity for them to engage that you can remind them of before we go tonight?
So we have a stage of the summit on the 25th, and they can go to our website and register. It's free. We welcome everyone to participate. Join us when you can. Listen into our discussions around frontline workers. Ken's been working really hard. We have an amazing lineup, and very excited. Ken, do you want to share some of our keynote speaker?
Yes, we actually got James Frederick, the Deputy Assistant Secretary for Labor, will be giving the keynote address on the 25th, so we're pretty excited about that. And it aligns quite well with those target industries that I spoke of: first responders, education, gig economy, and vulnerable populations in construction and ag. So it's very well lined up, and all of our speaker slots are just about filled. We're just missing, I think, one. But regardless if we have 4 or 3 speakers, I think it's going to be a very popular and informative back and forth. Now, as part of the CDC grant, we also have to disseminate a knowledge product, so we will be publishing on that as well in some summary article.
Great. That's awesome news. Thank you guys for doing such important work and sharing it with the One Health community. We appreciate your time, all the engagement, and hope you can join us next round in March. We'll have another speaker. So thank you again so very much. If we were in person, I would be gifting you a flag that's flown over the Capitol as a token of our gratitude. Unfortunately, in the realities that we are in, that is not possible at this time, but if we see in the future, that's what we owe you. So thank you so much again. And this concludes our presentation for tonight, everyone. So thank you so much for joining us, and we'll see you again soon. Everyone stay safe and be well.
Thank you.
Thank
Be
you.
safe.